welcome to Nursing School Explain in this video on hypovolemic shock. Now, hypovolemic shock is basically a loss of intravascular volume, and that can be a loss of volume, so of basically the fluid, or it can be loss of blood, or it can be a combination of the two. So if we're just losing fluid, this can be due to vomiting or diarrhea, or maybe a heat stroke, extreme dehydration, and so forth. But we can also lose blood or blood components from, let's say, a GI bleed or any kind of massive hemorrhage from a trauma or any kind of other injury. Now, those are fluid losses to the outside. They completely leave the body. But then there's also third spacing, such as in burns or maybe even patients with ascites who have third spacing in their abdomen. And that would basically be lost to the extravascular space where the fluids may still remain inside the body, but they are now out of the intravascular space. And whenever we think about loss of intravascular space, we have to talk about cardiac output and stroke volume. So pathophysiologically, if we now have decreased volume, we're going to have decreased stroke volume, which then leads to decreased cardiac output, which decreases the blood pressure, which means that our organs are not being perfused. The body is going to hold on to every drop of fluid, and therefore we have decreased urine output, and then eventually we'll have impaired cellular metabolism.